Good afternoon, and thank you for joining us today. I'm Patricia Capella, Conference Manager for Clarion Events Food and Beverage Trade Shows, which produces several industry events and conferences. During these uncertain times, we are doing everything we can to help keep our industry updated with education and stay connected during this rapidly changing environment. I'm very excited to introduce to you today Peggy Neu, President of Monday Campaigns, and Dr. and Chef Rob Graham, who is the co-founder and chief medical officer of Fresh Medicine. We will be discussing how to stay healthy and calm in anxious times in just a few moments. A few housekeeping notes before the presentation begins. All audience members are on listen-only mode, which means you are muted. We will be monitoring audience engagement on the dashboard and do encourage you to participate by using the question pane. There will be time for questions and answers at the end of the session. We do ask that you help keep the questions to general relevance and not so much personal. This webinar, as well as others in our series, will be made available on our website in the coming week. Now, without further delay, let me turn the program over to Peggy, who will kick off this webinar. Peggy?
Thank you very much. Thanks very much for joining us. I know this is a tough time for everyone, and particularly in the food service industry. So the fact that you're taking an hour to be with us, we're very appreciative. And Patricia is going to advance our slides. So as we're presenting, just to let you know that. And if you could go forward one, great. So there is, that's Peggy and Dr. Chef Rob in our work get-ups. So let me start off just to give you a little bit of an overview of what we hope to do. So what we're going to do is talk about the key elements of total physical and mental health, and also some specific tips on staying healthy during this COVID-19 crisis. So I'm coming at this as my job as president of the Monday Campaigns. And many in food service know Meatless Monday, but we actually have other campaigns that promote exercise, stress reduction, tobacco cessation, all using Monday as the day for a fresh start and to commit ourselves to healthy behaviors. So I'm going to talk more about that in a minute, but I just wanted to pass it over to Rob so you can introduce yourself.
Hey, Peggy, thanks so much for the introduction, and everyone really for tuning in. You know, we are so grateful and honored to be part of your day today, especially as Peggy mentioned during these trying times. Again, you know, just truly thankful for the restaurant and food service community for continuing to feed us during this horrible pandemic that we all have to weather together.
Okay, well, let me start off then, if you could go to the next slide, Patricia. So you might be wondering why Monday in terms of the goal of the Monday campaign, and it's not just about the alliteration of Meatless Monday. And it actually has great cultural significance as the first day of the week. People see it as a chance for a fresh start, and it's a time when we plan for the week ahead, you know, where we're going to be, when we're going to meet up with friends. Next slide. And when it comes to health, there's actually a lot of research that shows that that's the day when people tend to start diets, they start exercise regimens, they search for health information on the internet, they quit smoking. And we have a lot of research also that a healthy start makes it more likely that they can stay healthy and positive throughout the week. So the idea behind the Monday campaigns is to reach people when they're most open to making positive changes. Next slide. And I actually was thinking in getting ready for this webinar about the significance of the weekly cycle. And I think we're all going through a very similar experience now of just losing our sense of orientation. You know, our routines are being disrupted, the days, you know, kind of blend together. It's hard to not only manage the present, but to plan for the future. I actually had an experience last Monday where I have a standing meeting with a group of friends. And I knew that it was scheduled for Monday, but I didn't know that it was Monday. And I know that sounds, and so I forgot to attend. And so that experience, you know, of having the structure and routines, you know, disrupted is I think very disorienting. But for the next slide, I think it can
Peggy, what
also
day is it
though.
today, Peggy?
Oh, please. Now I know it's Monday. That's why we're doing this. Don't trick me. So next slide, please. So I also think there are opportunities, though, that this, you know, structure and routine have been disrupted. And the first important thing is just to create a new structure and routine that can just orient us in time. You know, I've read a lot, you know, that people say, oh, you should still take a shower and get dressed for work. I don't know that I've done that yet every day. But, you know, there are other things that people can do to just build in that structure. And in terms of health, I think there's an opportunity to adopt health behaviors that are tailored to our new challenges. And we're going to talk about this a little bit. I mean, we may not be able to go to the gym, but there are a lot of things, you know, you can do, you know, at home. And I think there are also opportunities to make positive changes that could be sustained after COVID-19. You know, so many people are cooking at home, they're having dinner as a family. So I think it's important to kind of look at some of these changes that have been, you know, maybe forced upon us and think, okay, what are some positive ones that we might be able to, you know, stick with over time. Next. So with the Monday campaigns, we have this idea of the Healthy Monday refresh. And the idea is to, at the beginning of the week, every Monday, to use it as an opportunity to check in, you know, with your emotional and physical health, you know, maybe let go of whatever's holding you back, you know, whether it's, you know, stress or worries, or even if you've gotten off a healthy eating routine. You know, and I think forgive yourself, don't feel bad or guilty, but just, you know, check in and say, hey, this is something I might not want to carry into the next week. Set positive intentions for the week and then refresh it throughout the week. And I think, you know, given this time of stress and worries and being off our routine, you know, you might want to do this frequently, every day or even every hour, because there's a lot going on. Next. So this is just something that the Monday campaigns offers is a weekly newsletter, and we've actually come up with a new version of it for COVID-19, which has tips and advice that are relevant to the situation we're all living in. Just ways you can reduce stress with self-care, you know, Meatless Monday recipes, recipes for Kids Cook Monday, and I'll be previewing some of these things throughout our presentation, but I just wanted to let you know that that exists. Next, please. And at this point, I am gonna hand it back to my friend and colleague and favorite Dr. Chef, Rob Graham.
Thanks, Peggy. You know, with us at Fresh Med, we have been, you know, great fans of the initiatives of the entire Monday campaigns for almost 10 years. Can you believe it? And in fact, you know, I'm really honored to be one of their global brand ambassadors because we believe so much in the Monday campaigns, especially because it gives us the opportunity to refresh or start fresh every single week. So I hope to do maybe in the next 15 minutes, it's kind of dive into this, what we think is a really interesting and unique approach to prevention and self-care. You know, one of the things that we're really proud about is that many people during circumstances like these, like pandemics and other troubling times, even the beginning of the years, we always want to start afresh. And I think this is the opportunities, as Peggy mentioned, that with challenges come great opportunities. And if you haven't really gotten your food, relaxation, exercise, sleep, and happiness, which are the defining what we call the ingredients in your recipe to health. And in fact, if you look at our name, RX, Fresh RX there, the RX is really meant to be not only a prescription, but a recipe in your foundational path to health. Next slide, please. So I just want to start off a little bit by, you know, putting what I consider an adorable picture of me. when I was like, a small kid. And I really thought that at a very young age, I wanted to be a doctor, not because, we help and heal, but really breaking down the word of what doctor means in Latin, to teach. And obviously, this is an opportunity for me to embark my story of being a physician. I also have a master's in public health, so it kind of gives me a bigger community perspective. And then, as Peggy mentioned, I'm, one of the very few, maybe 2 dozen doctors who's also went to culinary school to be considered a chef. And one of the principles that we have at Fresh Medicine, which is actually an active practice here in New York City, which I have converted now into what you see behind me is my home office. I'm doing telemedicine, but we really believe that self-care is the best form of healthcare. Next slide. And so again, Fresh Medicine is an acronym for what we call our 5 ingredients in your recipe to health: food, relaxation, exercise, sleep, and happiness. And again, over the next 15 minutes, I'm going to deep dive into each of those pillars or those ingredients. And I would like to start off my presentations with just reminding everyone, I know the WHO is facing some criticisms at this time, but I think 1948, they kind of set the stage in trying to determine what health really meant to both individuals and society. And I'd just like to read this out. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And think about that for a second. Just because you're not sick doesn't mean you're healthy. And we're starting to uncover many of the things that we're finding out during this epidemic or this pandemic, what really true health means. Next slide. And I just want to focus a little bit about this because this is what we're hearing a lot about now. And so oftentimes, our healthcare system is not really positioned itself for prevention and or health promotion. It really is about sick care. And just want to take time right now to, first of all, clap because we care every night at 7 p.m. for our healthcare workers who are really at the front line against this battle against this coronavirus. And really what you're looking at there is what we called, sick care. It's really managing illness and sickness. And unfortunately, we're starting to realize that a lot of the risk factors that are associated with coronavirus, particularly the ones that are most ill, are really preventable and modifiable by developing better lifestyle choices. And I think this is where, the money campaigns and what we at Fresh Medicine really try to do is really optimize lifestyle as medicine. Next slide. And so I just want to focus a little bit of this. I'm just going to go, next couple of slides are going to go a little bit into the epidemiology of what's happening right now with COVID-19, the coronavirus, and how we really have to adopt a method of medicine that really focuses on self-care and lifestyle as medicine. Because again, these are what we call the chronic diseases of America: heart disease, cancer, lung disease, stroke, Alzheimer's, diabetes, and chronic kidney disease. And in fact, 6 in 10 adults in the US have a chronic disease. And in fact, 4 out of 10 adults in the US have 2 or more chronic diseases. So, and if you start looking at who is impacted the greatest in this COVID-19 epidemic or pandemic are people with chronic diseases. And in fact, this weekend, a study came out that's saying the #1 risk factor is obesity. And as you know, nearly 50% of Americans are considered obese at this point. Next slide.
Can't see the slides.
And in fact, what we do know is that dealing with these chronic diseases, 7 out of 10 Americans are taking 1 or more prescription drugs, and over 50 million prescription drugs are filled annually. And one of the models that I have, right, is that, a pill for an ill doesn't work for many of these chronic diseases. These chronic diseases are lifestyle modifiable if we adopt a healthier lifestyle. Next slide. And in fact, this is hot off the press. Last month, the MMRW, which is comes out of the CDC, report suggests that people with underlying health conditions are higher risk for severe illnesses from COVID-19. Next slide. And in fact, when you think about what is the worst outcome when dealing with COVID-19 patients, it really is death. Next. And in fact, 94% were reported among patients. So 94% of people who have died from coronavirus or COVID-19 have at least one underlying health condition that's considered a chronic disease. So this is why it's so important, again, to take the onus onto yourself and promote more self-care. Next slide. And in fact, I'm always in the belief that our diet is the #1 cause of death and #1 cause of disability in the United States. I just want to repeat this again. It is not tobacco, it's not sedentary life, it is our diet. And this is why it's so important for us to really start thinking about our food choices, and that's why we really promote choices in reducing the amount of meat we eat and promoting Meatless Monday. And you'll see one of my prescriptions at the end. It's really simply, eat more plants. It's good for you and good for your planet. And in fact, today, if you saw the national news, in fact, our meat supply is being potentially affected by this coronavirus as well. So eating more plants, particularly on Monday, it's a good thing. Next slide. And in fact, I think right now we have to really think about how we're going to blend both the healthcare community, the medical community, and the food community. Next slide. And I'd just like to mention one of my favorite quotes of all time by Wendell Berry. So, people are fed by the food industry, which pays no attention to health, and are treated by a health industry, which pays no attention to food. And there lies the problem. And so therefore, we can sit back and really start thinking about how we can actually affect our health by the choices in food we make every single day. Next slide. And again, what better way to connect both the medical world and the food world by becoming a chef? And that was my picture on graduation day from culinary school. And again, the reason why I believe that there is a brighter future and we are going to be better, hopefully at the end of this coronavirus, is because of the power of prevention. And in fact, the CDC, the World Health Organization, and Harvard all agree that the greatest public health challenge we face in the 21st century are these chronic diseases. And in fact, this is the good news. 80% of heart disease, stroke, diabetes, and up to 70% of cancers can be prevented by not smoking, by exercising, managing stress, and eating a healthy diet. Next slide. And that's why, again, in our fresh prescription or our fresh recipe to health, the F stands for food, and that's where we like to start. Next slide. So when you go see the doctor or think about your own self-care, I really want you to start thinking about how you can improve your well-being. And I firmly believe, and my wife firmly believes, that the only way we can address our health is by addressing how we eat, how we relax, how we move, how we sleep, and how do we find happiness in the midst of this chaos. And for the next couple of slides, I'd like to share with you my food prescription. Next slide. So you've heard it for almost 2,000 years. Let food be thy medicine and medicine be thy food. Next slide. And with my partnership with the Meatless Monday campaign and the Meatless Monday, I like to just add a little bit to it. Let food be thy medicine, and if thy food is meatless, even better. Next slide. And in fact, I have a very simple message. My message for food is simply eat more plants. Communities and societies that eat more plant-based meals live longer. And in fact, plant-based doesn't necessarily means being vegetarian or vegan. It just simply means incorporating more plants into your dietary patterns. Next slide. Can't talk about plants without talking about beans and legumes. And one of the things I get asked a lot is, particularly during this time, how do we feed ourselves? How do we get enough protein? And again, beans, legumes are the greatest source of plant-based proteins. And in fact, they are awesome at this time of year, or at this time of this pandemic, simply because there are pantry staples. They have a long shelf life and they can be easily cooked if planned ahead. Next slide. And a question I get a lot about is, again, how do we increase our immune system? And again, eating more plants, eating beans and legumes, but don't forget about eating the rainbow of fruits and vegetables that are loaded with antioxidants and phytonutrients and phytochemicals. These are the building blocks of a healthy immune system. Next slide. And again, once you plate your meal out, at least make half or of your plate plant-based. Again, meaning increase the amount of plants that you put on your plate and crowd out the bad stuff. Next slide. And it's really important at this time, and in fact, we're starting to hear a lot about this. So this is actually a rooftop garden at one of our hospitals in New York City called Lenox Hill Hospitals. My wife and I, Julie, in 2013 had this idea that if we need to change how we eat, why don't we start growing our own foods? And as you know, we are facing an epidemic of bad foods in our hospitals and our schools. So therefore, we took the onus and started planting our own garden. Grow your own food. Next slide. And we converted that into, next slide, into this beautiful garden where doctors, nurses, healthcare providers, cleaning people, anyone come out there and enjoy the bounties of our labor. Next slide. And this is again, the chef, my wife Julie and I on Victory Greens. Next slide. And we're starting to see this movement happen more and more. And in fact, seeds are actually being sold out in many nurseries because, again, our food supply, our food chain, it's been disrupted. And it's a great way to think about how to grow your own foods. Next slide. And this is me and the chef on a rooftop garden. Next slide. And in fact, I just want to stick with this because, again, one of the things, remember, we're in the food section right now, and the gut microbiome, these are the little bugs and bacteria, fungi, and viruses that lie within our intestinal tract. And we're learning much more about the microbiome over the past 10 years. Its role in immunity, its role in metabolism, but really, what I find fascinating, it's the role of the immune system. And in fact, 70 to 80% of our immune system resides in our microbiome. So therefore, if we want to increase our immune system, I say it starts with food. And in fact, going from a standard American diet, which is about 80% processed foods, to a more plant-based diet, you can actually change your microbiome, improve your immunity within 3 days. So here's my challenge to you. Incorporate more plants, more beans, and eat the rainbow over the next couple of weeks to see how great your immune system and you feel as you battle this coronavirus by yourself. Next slide. Oh, I can't forget this. Hydrate, drink the water. Peggy?
Yep, next slide, please. So, and of course, go meatless on Monday. The food service industry has been, such a great partner in spreading the Meatless Monday movement. It's actually in over 40 countries now in 23 different languages. So it's really, the viral growth of it has been amazing. And I just wanted to update you on an initiative we're doing that actually maybe you could participate in. We've just found on social media and our website that what people want are pantry staple recipes. They want to know, what to do with them, easy, meals to make with the can of beans. And we did this fun promotion on Instagram, which really got a lot of traction of getting people to do pantry staple bingo. So it's almost like this fun game that people can do with one another of, okay, it's beans for the 5th night. Now, what can I do with them to make them good? And also, how do I combine different ingredients? So we're going to start this global pantry challenge. And this is kind of a way to get that solidarity between all of the countries that are going through this, where we're asking people to share pictures and videos of what's in their pantry. And then to tell us, what are the pantry heroes, things that you're using all the time, and then what are the pantry zeros of, ingredients you maybe thought you were going to use, but you kind of haven't, and you don't quite know what to do with them. And then we're going to get help from a lot of the chefs in our network. Actually, Dr. Rob, I think, and Chef Rob, I should say, you're going to be one of them. People we're going to call on, to kind of help you turn the zeros into heroes. So, go to our Meatless Monday hashtag and share your pictures and videos to stay tuned on this. Next slide. The other initiative that I think you might be interested in is the Kids Cook Monday. And the goal of that is to, encourage people to have a family dinner and get kids involved in the kitchen at least once a week. And during this time when everyone's home together, I think it's a perfect way to get this ritual started. We put out every week a family dinner date newsletter where you get kid-friendly recipes, you break down instructions of what different age kids can do in the kitchen, and then tips for having conversations with your kids. So, this is another resource we offer that might be helpful during this time. Next slide, please. And back to Dr. Rob.
Yeah, Peggy, I love that initiative. And actually, I'm encouraging my brother-in-law and my sister-in-law who are not, comfortable in the kitchen to get in the kitchen. I think it's a great self-defense at this point, really trying to get comfortable in the kitchen so that you can cook for yourself instead of relying on others at this point. Obviously our food and restaurant service providers are still cranking out food, but at the same time, I think for overall health and well-being, I think cooking is also medicine. So I actually like to go to the second letter in our fresh prescription, which is relaxation. Next slide. And in fact, 3 out of 4 visits, doctor visits, are due to stress. It doesn't mean going to the doctor is stressful. In fact, what I mean by that slide is that every single thing that a patient comes in to see us for is due to stress to some component. Next slide. So again, when you're feeling stress, and I can imagine everyone has experienced this physiological response, and I'll show you what that means in a couple of slides, is when you're feeling overwhelmed or you're feeling quote unquote stressed, the first thing I want everyone to do is just to pause for a second and tune in to see how you're feeling. Next slide. And again, this is a very complicated slide, and I really want you to really just simply understand two principles here, is that everyone has experienced a stress response. And that is when your pupils dilate, your heart rate goes up, you start breathing faster, and it is driven by a hormone that's made in your adrenal glands called cortisol. So that's an appropriate response, but when cortisol continues to be elevated secondary to a stressful response, in fact, it actually decreases your immune system. The physiology behind it's very complicated, but I just want you to take that away, is that when you are stressed, a hormone called cortisol rises. Prolonged rises in cortisol decreases the immune system, which we don't want to have at this time. What's fascinating about the stress response is that there's an equal and opposite relaxation response. Then in fact, 80% of the times we talk about this, my wife and I talk about this, many people have heard of the stress response, but don't understand they have an equal and opposite and strong relaxation response. And I think Peggy will dive into that a little bit later. Next slide. Next slide. And in fact, the only way, well, one of the ways, and I think the most important way to tap into that relaxation response is to focus on your breath. So let's all take one deep breath. Next slide.
So, and to help you take a deep breath, we've developed a series of fun animated visuals, which you can find on our De-Stress Monday website, that just encourage you to breathe with the shape. And one of the things about breathing is that it's really good to do slow and deep, really breathing into your lower belly and not just shallow, fast breathing. And the one thing I think that can really make this practice powerful is to focus your mind on your breath. So, this is often called mindfulness practice, where, as you're focusing on your breath and the sensations of the chest coming in, rising and falling, and the air coming through your nose and mouth, to really try to focus that. And if you get a distracting thought, just let it go and return to the breath. And then that kind of has double benefits of deep breathing and mindfulness. Next slide. Another practice which is recommended in mindfulness is we all get into those situations where a negative thought will take hold. like this. And it just grabs onto your attention, and it won't let go, and it leads to kind of rumination, and suddenly you're down that rabbit hole. So one of the visualizations you could try is just when that happens, and an unwanted thought hits you, just think about it as a cloud, that can just pass by. And it's not like the circumstance that's negative will go away. It won't. But your relationship to it can be a little less attached. Next slide. One of my favorite visualization exercises is actually from Rob's wife, Julie Graham, and she does a wonderful guided meditation with it on our website. But the idea is just take whatever stress or worry you might be experiencing, think about putting it in a red balloon, and then just let it float away. And another technique that is kind of fun, but I think very effective to just detach yourself from those negative thoughts and worries. Next slide. And back to Dr. Rob.
Yeah, Peggy, obviously we were such fans of what you guys do in the Monday campaigns. And that example right there, we actually prescribe, and like I said, this whole model of Fresh is, I literally prescribe food as medicine, relaxation as medicine. And I often tell a lot of my patients, where do you start? That first Giphy with the expanding circles, it's something that I literally, as a physician, prescribed almost every single day. And so a lot of patients get stuck up in this mind meditation. How do I meditate? How do I meditate? And I say, again, it starts with breath. And I say, and I love those Giphies that you guys do. Now it goes to E, exercise, our third letter here. Next slide. And I just want to frame here, obviously things are a little more challenging now to try to get your exercise in. But I just want to mention here what the government recommends. So as adults, we should aim for 150 minutes of moderate intensity activity. And in fact, what's really important is that we should also be trying unique ways. And I know Peggy's going to be sharing with you some of the techniques that the Monday campaigns really tries to promote during this time. The idea here, again, similar to our meditation and relaxation, is that when you think you're sitting around too much, which obviously with Netflix binging and everything and working from home, is just to stand up for a while and start moving. And we can talk about certain exercises you can do at home, like yoga, bed yoga, carrying shopping carts. And it's not about being on a treadmill, or like I call the dreadmill or the Swearmaster. It's really just getting around and moving a little bit more. Next slide. And in fact, we know what I've been doing. I've taken it old school. And these things that we used to make fun of, jumping jacks, push-ups, sit-ups, crunches, lunges, squats, it's really become my routine now. And in fact, we were able to purchase an elastic waistband to help with a certain resistance training. So again, go back to the way we used to do it before the gyms, before the equinoxes, and really just use your own body as its weight. And in fact, yoga is a great example of this. Next slide.
Yeah, one thing I just want to mention, we have this initiative, Move It Monday, and one of the most searched terms that gets people to our site is exercises without a gym. And I think that is really a terrific example of something you could start up in this new period of being home. You can exercise, just using everyday equipment that you might have at home. And here's one example. This was provided by our friends at NYU Langone, and it's chair yoga and bed yoga. And it's, we have some videos that you can look at on our site, again, just using a chair and a bed. Everyone has those two things. And one of the things I'd just like to mention is that there are so many online videos that are, people are using during this situation. I mean, I have live yoga classes on the weekend, Saturday and Sunday, if I can remember what day it is. And, I understand that all these vintage Jane Fonda, videos are coming back. So, it's just a great thing to take advantage of during this time. Next. the other thing I would just say is like family fitness can be such fun, and you could think about building in breaks throughout the day, with competitions for knee ups or a balance challenge or even a dance contest. And then again, kind of gets everyone together doing something fun. So, that would be another tip I would offer. Next.
Yeah, it's funny. We've incorporated a lot of this into our prescriptions lately. And in fact, my mother-in-law and my mom are doing bed yoga, which is kind of cool. And then I think there's something going viral called "Give Me 10." C10, give me 10. So we're incorporating, and I'm going to be doing this, is C10 push-ups, give me 10 push-ups. Try to do 10 push-ups, Peggy. It's not as easy as it sounds.
Yikes.
Yeah. All right. So our fourth letter, our fourth pillar, our fourth ingredient is sleep. Next slide. So we believe so much that sleep is a vital component of our health and well-being that we prescribe it as medicine. And in fact, if you think about what is recommended, 7 to 8 hours of uninterrupted sleep is what's recommended. And a really important time at this, particularly when there is you lose track of time, days, and hours. It's really important, I think, to try to stick to a routine as much as possible. Again, I always say within an hour or two of your normal bedtime. But again, try to stick to 8 hours of sleep. One important factor to consider, particularly during, at least here in New York City, our temperature is really fluctuating, and keep your bedroom cool. Anywhere between 64 on the cool side to about 68 on the hottest side. That seems to be a very comfortable temperature for most people to find that relaxation, that ability to fall asleep. And just going back to the E, just like dogs, if you ever ran a dog around a house or around the park, that night that dog sleeps very well. So do we. We need to move, and the more we move, the better we sleep. So exercise daily. And the fourth thing here, no electronics in the bedroom. Really, the bedroom is supposed to be a sanctuary. And in fact, nowadays, when there is a less structure in your time, you tend to spend a lot more time on your iPads and your iPhones and your phones. And again, not to mention not the blue light that comes in with it. Again, it's very stimulating and distracting. So again, no electronics in the bedroom. Again, these are just things that we're recommending as challenges for you. Next slide. And in fact, one of the most important things I think we have to really be mindful of in the next, who knows, maybe say three months now, is that, there are a lot of people that are suffering, and a lot of people, in fact, today we got a message of a friend who passed away from coronavirus, 48-year-old guy, and if at night you can't sleep, count your blessings instead of sheep. So it's a really important time just to be honoring yourself, and the ability to fall asleep in your home is really a blessing. Next slide.
And I would just add a few other things to that. If you're looking like the cat here and can't get asleep and then want to, slow down so that you can get to that point. Another strategy is maybe soothe your senses with lavender, another relaxing smell. Definitely unplugging, which Rob talked about. And there are just a lot of guided audio meditations that are specifically, we have some on our website, but there are a lot of others out there that can, help you get to sleep. Next slide. And then one other technique that I like a lot that might be appropriate for this time is just to have a visual of breathing in light and breathing out dark. And while you're breathing in light, it might be thinking about everything you're grateful for, or a positive memory, or of some sort. And the breathing out the dark might be, something, the worries and anxieties that are keeping you up. So, again, just another sort of visual trick that might help you. Next slide.
Our last letter, happiness, and probably the most important in our prescription and our recipe to health. This is really based upon my wife's work in positive psychology. So I want to take a second here to just mention how I do medicine. I've been in academia for almost 20 years. And about 3 years ago, I stepped away simply because I believe that there has to be more focus on health promotion and prevention. And that's why we really started Fresh Med. And in fact, our Instagram and our website contain a lot of information called FreshMed NYC that can help you find happiness. And happiness in this regard is based upon the study of positive psychology. And we'll dive into that a little bit. But it's not about happyology. Listen, this time during the coronavirus, it's stressful and there's sadness. And it's really about understanding your own strengths to optimize your own happiness. And I know Peggy and I really share a lot of similar belief theories behind this happiness model. Next slide. And I just want to remind you here that the purpose of our life is to be happy. And again, happiness is a pursuit of happiness. It's a verb. Next slide. And so I challenge all of you to do this every day, not just during this stressful time, but every single day in your life. And in fact, my calendar at the office and now at home, at noon, I ask myself, are you happy? And life is literally this simple. Life is simple. Are you happy? If you say yes, you keep going. If you say no, change something. And if you change something, ask yourself, are you happy now? And if you're not happy, change something. Again, it is a verb, and if the action is on you. Next slide. I just want to focus a little bit on this. And obviously, again, my wife Julie is the expert in this field. Positive psychology is a scientific study of the strengths that enable individuals and communities to thrive. The field is founded on the belief that people want to lead meaningful and fulfilling lives, to cultivate what is best within themselves, and to enhance their experience of love, work, and play. As in the intro, Peggy mentioned, this is a time, an opportunity for us to really start thinking about what is it truly we want in life, right? We're all home right now. Many of us are home. Some of us are not and are working. Even for those that are working, is this what you want to do? This is one example of that. Life is short, and don't wait for something to happen. You be the change. You be the change that you want to see in your life. Next slide. And again, I just want to remind you, this is an important concept here, is that evolutionarily, we are wired to be negative. In the Saharas, in evolutionary times, missing the bad was life-threatening. If you missed that tiger behind the bush, that was bad. So always, we are wired to be negative. And if you ever creep up on an animal in a room, they are immediately startled. Again, missing the bad is good. Missing the bad was life-threatening. I'm sorry, missing the good was not. So therefore, all programming in this new world can't change. The hardware is not going to change. You have to update your software. You have to wire yourself to be positive. Next slide. And again, this goes back to the great work of Carol Dweck in the field of positive psychology. And again, we can spend a whole seminar on this, a whole webinar on this, and it's really looking at during times, anytime really, do you have a growth mindset or a fixed mindset? Is this going to get better? Some examples of this. I'm either good at it or I'm not. And in fact, I would disagree with that. I think failure is an opportunity to grow. I think challenges help me to grow. And I think this is something to reflect on during this troubling times. Next slide. And in fact, this is something that, Julie does with all her clients. The first step is identifying your strengths. Many people are self-critical of themselves and their abilities and their strengths. And if you go to viacharacter.org, you can actually take a quick quiz to find out what your strengths are. And the idea here is to optimize on your strengths, not on your weaknesses, because in fact, there's no weaknesses, there's just level degrees of strengths. Next slide. And in fact, here's just a simple Positively Psyched. This is one of Julie's online books called Positively Psyched, which she basically has done is use her iPhone and capture the ABCs of positive psychology, one word at a time from A to Z. And what I mean by that is that, for example, her first A is awe. When was the last time you actually looked up in the sky and you felt that wonderment, that awe? For me, it's every night when we clap because we care, when we go outside our windows and we clap for our essential workers. For me, that's an awe experience. And that awe experience resonates for me throughout the entire day. And I actually look forward to doing that every single night now. Next slide. And again, during this time of what they call social distancing, I like to change that verb into what we call physical distancing. Because in fact, we actually understand through the field of positive psychology by the late great Chris Peterson mentions that it can be surmised in 3 simple words: other people matter. And in fact, when physical distancing is a challenge right now, we're able to connect. And the next slide. And this is how we connect nowadays, right? Look at this. I'm seeing Peggy right now. We're on this webinar. We're on Zoom. But in fact, my parents who were in the 80s, my mom's in the 80s, and you should have seen the wonderment, the awe she felt when I first FaceTimed her during this epidemic. That was the first time. And we said that at least once or twice a week, we're going to be FaceTiming. So therefore, we can be physically distancing, but again, still connected. Next slide.
So I would just
Peggy?
like to leave you with one practice, and then we just have a few slides showing where you can get in touch with us, and then we're going to open it up to questions. But this is called loving kindness practice, and I think it's very powerful. The way it works is that you just hold in your mind either a loved one, someone that you have a challenging relationship to, or even someone that is neutral that you don't know very well. And then just repeat a phrase, holding them in your mind. You know, may you be happy, may you be well, may you live at ease. During this time, you might say, may you be safe as well. And I think this is very powerful because it cultivates in you compassion and happiness just by the fact that you're sending that out into the world to other people. And next, please. And I think, as many of us know, happiness is contagious. So if you're someone that is smiling, that is wishing people well, that is putting out positive energy, that in turn will make other people happy, and then it spreads from there. Next slide. And I think that, you know, one of the things, as Rob was saying, that has been so inspiring and has lifted our spirits is the degree to which the world has expressed their gratitude to all our frontline workers. So, you know, that improves our spirits, our mood, and it's as good for us as it is for other people. Next slide. So with that, I'll give it back to Dr. Rob.
Yeah, these are just our kind of final slides here. And, you know, as a physician, I always like to offer you my recipe and my prescription for health. And so when it comes to food, simple. What I try to do too, what we try to do at Fresh is really kind of give a simple message here. When it comes to food, eat more plants. When it comes to relaxation, relax for 10 minutes a day. You owe it to yourself. Exercise 30 minutes a day, sleep 7 to 8 hours a night. And when it comes to happiness, as Peggy just mentioned, and what we discussed before, other people matter. Next slide. And this is one of our mottos. When it comes to our health, it all starts with food. But in the end, what we truly want in life is to be happy. And I'm really happy to be sharing my time with all of you, and of course with Peggy. And if you want to get in touch with me and or my wife Julie to do yoga and meditation, and this is our QR code here. You can click a picture of it, and it'll bring you right to our website. Our Facebook, Twitter, and Instagram is all FreshMed NYC. We're located here in New York City. We hope to be back in business after this coronavirus. But for the meantime, I do take telemedicine phone calls. And again, I'm really excited about the other initiative, FreshMed U. www.freshmedu.com. Again, follow us on Instagram and Facebook. Next slide. And because we love our frontline workers, and obviously this is a more focused on the restaurant and food service community, we have done something really unique. Julie, over the last 6 months, developed a course called FreshMed U. And it's really an online school, a university, where we dive deep into what we call the fresh 5 ingredients in your recipe to health. A lot of the information there is scientifically driven with a collaboration with the Monday campaign. So a lot of the gifts that you saw Peggy introduce will be on that as well. And in fact, we have offered a coupon code for all frontline workers, IRFS. Again, it'll be available for 60 to 90 days, depending on the engagement. Again, it is completely free for all of you frontline workers. Just a little a tip of the hat or a gratitude to all of you sacrificing your health and well-being to continuing to feed us. So thank you so much.
And next. I just wanted to direct you to our main website, the Monday campaigns, and you can get to all of our other specific initiatives, follow us on social media, here, and I just wanted to join Rob and thank you very much for being with us, and you know, best of luck to everyone. And
Thank you so much, Peggy and Dr. Rob. That was a terrific presentation and such wonderful information. I know I certainly learned a lot. And Dr. Rob, I'm going to take you up on some of the challenges that you mentioned. Before we do have some questions coming in, but before we go to that, I just want to remind everyone that this webinar will be made available on our website, which is foodandbevshows.com. You will also receive an email this week with a live recording of the webinar too, so you can listen in and look at the slides at any point. We're just stopped at this page quickly just to share with you all that as we receive content and information from all of our industry experts and partners and associations, our team is continuously updating our industry resource page. So please be sure to keep checking foodandbevshows.com for additional webinars that will be coming about. So without further ado, let me go to the first question that we have here. Excuse me. Are there online tools for meditation or lifting our daily spirits and staying calm?
Totally.
Yeah, there are a lot of tools. I mean, on De-Stress Monday, we have a lot of meditations, recorded meditations. Also, the group I've been involved with, the Nalanda Institute for Contemplative Science, has a special free page for, meditations geared towards COVID-19. And I think Headspace is another really good resource. Rob?
Yeah, I like Calm. I know a lot of them are reaching out to offering, short-term free subscriptions to their apps, Calm, Headspace, and Will, WHIL. And again, I have to plug De-Stress Monday. I think those are fantastic online sources. I personally love my wife's meditation the most, which finds me much more relaxed. But otherwise, yeah, I think there's a ton of things. But start off with I think De-Stress Monday.
Thank you. Next question, they had said, thank you, this is great information during this time. How is it possible to stay informed without staying tuned into the news, which can cause a lot of anxiety? Do you have any suggestions?
Well, I'll just say, I mean, I'm trying to do this from a personal point of view for myself, is just checking in a couple times a day, maybe once in the morning and another time later. I mean, however much you think you need to. But, for me, I just want to keep updated and know what the news is. But, just being attached to it all throughout the day, I think is not necessarily helpful. Rob?
Yeah, personally, I think we're all challenging. It's a challenging time, and trying to stay connected, but at the same time, giving us a buffer. I tell you what we do here. We like to hear what Governor Cuomo says. Obviously, it's more personal to us here in New York City and New York State, but it really kind of gives us a synopsis of what's happened over the 24 hours and what to expect over the next 24 hours. We find it entertaining to watch the things that are not related to the news as well. I think it gives us an opportunity to check in. What I have done too, I know the New York Times has done a free subscription to COVID-19 series. And so I have notifications on when there's a breaking news only. So again, it keeps me in tune, but it does not, overtake my entire day.
Great, thank you so much. Yeah, I've actually been doing the same thing. I set up myself up for the alerts, and then if anything, just watch the news about a half hour. As you mentioned, Peggy, it just gets too much to be tuned in all day long. The next question we have is on plant-based diets. They're big now and hearing a lot about the health benefits. Are there good places to find recipes, and what are the best places to shop for plant-based foods online?
Oh, well, I just got to say it here. Here's a plug for one of my favorite cookbooks here. It's Monday cookbook here. But again, their website has an amazing resource. I've had the great opportunity to go to culinary school at the Natural Gourmet Institute. They have an amazing cookbook that came out with as well. And I think you're starting to learn more and more and more every single day about the power of plants. And not overall for your overall health, but particularly this time immunity. And what I find fascinating is that we adopt a mostly plant-based diet protocol lifestyle here at my house. And in fact, if you go to the grocery stores, what I find amazing is that there's so much produce in every single supermarket at this point. But in terms of recipes, I think Meatless Monday, again, going back to the Meatless Monday website, amazing resource for very simple, again, shelf stable. And I think I'm really interested. I'm very excited to participate in the pantry challenge.
Good. Yeah, and in terms of ordering online, I mean, I think in a lot of places that's been a tough challenge, just having the availability. But, plant-based options and produce and the sort of plant-based substitutes are widely available, nowadays. And so to the degree that you can get delivery service, normally supermarkets would have that in stock.
But I also want to mention that the fact that it's plant-based, but it's also whole foods. I think that's something that I just want to mention is that there is a lot of faux meat that's happening right now. Faux sausages, faux hamburgers, faux hot dogs, faux bacon. I think if it taints the word faux, I think it's faux. I think we have to focus back on eating whole foods, mostly plant-based.
Great, thank you. And this kind of leads into our next question, which you said to eat more plants, but do you think red meat is bad for you, even in small amounts?
This is again personal opinion based on some science. And I think, science is really interesting because you can actually tell a story depending on where you look at the research and what perspective you actually offer it in. So my recipe is this, eat more plants, eat less meat. And if you eat meat, make sure it's good meat. I think that's something that we have to start thinking about, not only for our own personal health, but also from a planetary health point of view. So again, it's a challenge to eat good meat in this era as well, but I think you have to be, again, an informed consumer of where our meat comes from, because I think it's a big, big problem. And I think there is a link between climate change, planetary health, and in fact, this COVID-19. You think about the potential source of where this originated in. And I think this is something that we all have to be just more mindful of.
I would just add to that, we find through our research, one of the barriers that people have to reducing meat in their diet is they think they won't get enough protein. But in fact, there are so many plant-based sources of protein that are healthier because they're lower in saturated fat. So it is possible, to be, predominantly plant-based or all plant-based, getting protein sources from legumes, beans, and other sources.
Great, thank you so much. That actually wraps up. Oh,
I'm sorry.
No, go ahead.
Yeah, there's a couple of websites that I just like to say again. I don't have affiliation with them, but I follow them. Physicians Committee for Responsible Medicine. I know they're good people offering good advice, particularly to healthcare providers during this challenging time when it comes to dietary choices. And I think there's more information out there than one may think on the benefits of a plant-based diet.
Great, thank you. So that actually wraps up our questions for now, but I just wanted to throw it back to you, Peggy and Rob. Did you have anything else that you wanted to add? Any last minute, last words to share before we part for the day?
Well, I guess I would just like to go back and thank everyone for joining and just acknowledge that the people in the food service industry, many of you on this webinar, are going through tougher times than the rest of us. And so I very much hope that the information, insights, practices we've shared, will help just a little bit, get through this time. So thanks very much.
Yeah, I just want to echo that. Complete gratitude. I live in two worlds. I live in the healthcare world and I live in the food world. And my people are struggling during this time. And again, I hope you found it helpful. I just want to echo the point that I want all of us to stay safe. And in lieu of our time, I think it's also important to take responsibility of our own healthcare at this point. Again, self-care is the best form of healthcare. And I also want everyone to stay fresh. You too, Peggy.
Well, thank you.
Okay,
well,
I
thank
will,
you.
starting Monday.
Thanks so much again to both of you. It was really great to have you with us today and share your expertise. I hope everyone has a great afternoon. Stay safe and healthy. And until next time, thanks so much.
Thank you.
Bye.